Of course, this is an excellent and important question, as both conditions affect the same organ and can have overlapping symptoms, but they are fundamentally different diseases. Here is a detailed explanation comparing benign prostatic hyperplasia (BPH) and prostate cancer. At a glance, core differences feature benign prostatic hyperplasia (BPH) prostate cancer nature non-cancerous overgrowth of cells. Malignant cancerous uncontrolled cell growth. Origin primarily in the transition zone inner part of the prostate surrounding the urethra. Usually originates in the peripheral zone outer part of the prostate. Effect squeezes the urethra, causing obstructive and irritative urinary symptoms. Invades surrounding tissues, for example, seminal vesicles, bladder, and can metastasize, spread to bones, lymph nodes. Threat not life-threatening, but can severely impact quality of life. Potentially life-threatening if not detected and treated early. 1. Benign prostatic hyperplasia (BPH). What is it? BPH, often called an enlarged prostate, is a benign non-cancerous increase in the number of cells hyperplasia of the prostate gland. It is a normal part of the aging process for men and is not a form of cancer, nor does it lead to cancer. However, both conditions can coexist. Causes and pathophysiology. Hormonal changes. The primary driver is believed to be hormonal changes associated with aging, specifically the conversion of testosterone to dihydrotestosterone (DHT), which stimulates prostate growth. Aging. BPH is extremely common. Over 50% of men in their 60s and as many as 90% of men in their 70s and 80s have some symptoms of BPH. Location. The cell growth occurs mainly in the transition zone, which is the area of the prostate immediately surrounding the urethra. As this area enlarges, it compresses the urethra like a clamp on a garden hose. Symptoms. Lower urinary tract symptoms. LUTS symptoms are caused by obstruction of the urethra and the bladder's reaction to overcome that obstruction. Obstructive symptoms. Weak urine stream, straining to urinate, hesitancy, delay in starting urination, dribbling at the end of urination, feeling of incomplete bladder emptying. Irritative symptoms. Urgency, sudden, strong need to urinate, frequency urinating often, especially at night, nocturia. Diagnosis, medical history, and symptom score (IPSS), a questionnaire to quantify symptom severity. Digital rectal exam (DRE). The physician feels the prostate through the rectal wall. In BPH, the prostate is often symmetrically enlarged and smooth, but it may feel large without hard nodules. PSA blood test. Prostate-specific antigen levels can be elevated in BPH, but usually to a mild or moderate degree. Urine flow test measures the strength and volume of the urine stream. Post-void residual PVR measurement uses an ultrasound to check how much urine is left in the bladder after urination. Imaging. Transrectal ultrasound truss can be used to measure the exact size of the prostate. Treatment. Lifestyle changes. Reducing fluid intake before bed, avoiding caffeine and alcohol. Medications. Alpha blockers, for example, tamsulosin, relax prostate and bladder neck muscles to improve urine flow. 5-alpha reductase inhibitors, for example, finasteride, shrink the prostate by blocking the hormone DHT. Minimally invasive procedures. Procedures like Reserm steam therapy, urolift clips that hold the prostate open, or TUMT microwave therapy to remove or compress obstructive tissue. Surgery. Transurethral resection of the prostate TURP is the gold standard surgical procedure for removing obstructive prostate tissue. 2. Prostate cancer. What is it? Prostate cancer is the uncontrolled, malignant growth of cells within the prostate gland. These cancer cells have the potential to break away from the original tumor, enter the bloodstream or lymphatic system, and form new tumors metastases in other parts of the body. Causes and pathophysiology. Genetic mutations. The exact cause is unknown, but it involves genetic mutations that lead to uncontrolled cell division. Risk factors. Age most common in men over 65, family history, race more common and aggressive in African American men, and obesity. Location. About 70 to 80% of prostate cancers originate in the peripheral zone, the outer part of the prostate that can be felt during a DRE. This is why a DRE is an effective screening tool. Symptoms. Early-stage prostate cancer often has no symptoms. When symptoms do occur, they can be identical to BPH because a growing tumor can also press on the urethra. Urinary symptoms frequency, hesitancy, weak stream, etc. Identical to BPH. Advanced cancer symptoms are more telling and indicate the disease has spread. Blood in the urine or semen. Erectile dysfunction. Pain in the hips, back, chest if it has spread to bones. Leg weakness or swelling from lymph node involvement. Unintended weight loss. Diagnosis: PSA blood test. A high or rapidly rising PSA level can be a red flag for cancer, though it is not definitive. Digital rectal exam DRE. A physician may feel a hard, irregular, or rocky nodule on the prostate, which is suspicious for cancer. Biopsy. The only definitive way to diagnose prostate cancer. If PSA or DRE is abnormal, a transrectal ultrasound truss a guided biopsy is performed. A needle takes multiple small samples of the prostate to be examined under a microscope. Imaging. If cancer is confirmed, advanced imaging like MRI, CT, or bone scans are used to determine if and where the cancer has spread, a process called staging. Treatment is highly personalized based on the cancer stage, how far it has spread, Gleason score, how aggressive it looks under a microscope, and the patient's age and overall health. Active surveillance for very low-risk, slow-growing cancers. The cancer is monitored closely with regular PSA tests, DRS, and biopsies, and treatment is initiated only if it shows signs of progression. Curative treatment for localized cancer, radical prostatectomy, surgical removal of the entire prostate gland. Radiation therapy, using high-energy beams to destroy cancer cells. Advanced cancer treatment if metastasized. Androgen deprivation therapy ADT. Hormone therapy to stop the body from making testosterone, which fuels prostate cancer growth. Chemotherapy, immunotherapy, targeted therapy, used when hormone therapy is no longer effective. Key similarities and why they cause confusion: same organ. Both conditions originate in the prostate gland. Similar symptoms, especially in the early stages, both can cause obstructive and irritative urinary symptoms, LUTS. You cannot tell them apart based on symptoms alone. PSA elevation. Both BPH and prostate cancer can cause an elevated PSA level. A high PSA does not mean you have cancer, and a normal PSA does not completely rule it out. Aging. The risk for both increases significantly with age. Summary. The critical takeaway, the most important distinction, is that BPH is a benign condition that causes bothersome symptoms but is not dangerous, while prostate cancer is a potentially lethal malignant disease that often has no symptoms until it is advanced. Because their symptoms overlap, it is crucial for any man experiencing urinary changes to see a doctor urologist for a proper evaluation. This evaluation, which includes a PSA test and a DRE, is designed to distinguish between these two common conditions and rule out the possibility of cancer. Early detection of prostate cancer dramatically increases the success rate of treatment.